What if the key to calming your joint pain, improving your immune health, and even reversing autoimmune conditions started in your gut? Let's explore how your gut controls your immune system and what you can do to support it. Hello, this is Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and restore your health using innovative, low-risk strategies that treat the root of the problem. Today, we're talking about something that affects almost every system in your body, your gut. In this video, we're going to cover what the gut microbiome is, how it regulates your immune system, why it plays a major role in autoimmune conditions, and most importantly, what you can do starting today to heal your gut and support your immune system. If you're struggling with joint pain, fatigue, autoimmunity, or even just gut issues like bloating and food sensitivities, this is for you. New research has confirmed what many have suspected for years: your gut is deeply connected to inflammation, pain, and immune regulation. The good news, you can begin to change that with simple science-backed steps. Your gut microbiome is made up of trillions of microbes, mainly bacteria, but also viruses and fungi, living mostly in your large intestine. This community of microbes plays a key role in digestion, vitamin production, metabolism, and immune system balance. In fact, about 70% of your immune cells live in your gut. When your gut microbiome is healthy, it helps your immune system function properly, attacking infections, but staying calm toward your own body. But when that microbial balance is disturbed, a state called dysbiosis, the immune system can become confused. It may overreact to harmless foods or bacteria. Over time, it may even attack your own tissues, leading to autoimmune conditions. Common causes of dysbiosis include a low-fiber, highly processed food diet, repeated antibiotic use, long-term NSAID or acid blockers, poor sleep and chronic stress, and lack of microbial exposure from natural or fermented foods. Research in journals like Nature Reviews Immunology and Cell confirm that this imbalance can directly affect immune tolerance and may be a root trigger in autoimmune diseases. The gut has a lining that acts like a tightly regulated gate. It lets in nutrients and blocks out toxins. But when that lining gets damaged, it becomes leaky. That means particles like undigested food, bacteria, or toxins slip into your bloodstream. This triggers your immune system to attack. Over time, it can become overly active and even start attacking your joints, skin, thyroid, or brain. This is the theory of increased intestinal permeability, also known as leaky gut. It's supported by a growing research in autoimmune conditions, including in Frontiers in Immunology and the British Medical Journal. Another concept is molecular mimicry. Some gut bacteria have proteins that resemble your body's own tissues. Once your immune system starts attacking those bacteria, it may begin attacking your joints or organs as well. This connection helps explain why so many people with autoimmune conditions also may experience bloating or irritable bowel syndrome symptoms, food sensitivities, fatigue or brain fog, skin conditions, and even anxiety or mood swings. Your gut and immune system are deeply intertwined. But there's good news. You can support and rebalance the system. Healing your gut is not about one magic pill or supplement. It's about restoring balance through consistent, simple, science-supported habits. Let's walk through 6 key strategies. Number 1 step is fix your food first and foremost. Your food choices shape your microbiome more than anything else, even more than genetics or medications, according to the Lancet Gastroenterology and Hepatology. So you want to focus on high fiber vegetables and fruits. You want to aim for 6 to 8 servings daily. Think leafy greens, broccoli, apples, berries, and avocados. Also fermented foods such as yogurt, kefir, kimchi, sauerkraut, and miso. A 2021 study in Cell found that fermented foods increase gut diversity and reduce key inflammation markers like interleukin-6. Polyphenol-rich foods such as green tea, olive oil, cacao, and berries. These will actually feed healthy gut bacteria as well. On the other hand, you want to avoid processed foods, refined sugar and flour, industrial seed oils, artificial sweeteners like aspartame or sucralose. These disrupt gut flora and promote inflammation, as shown in Gut Microbes Journal. Number 2 is try an elimination diet. An elimination diet helps you identify foods that trigger your immune system, and this may vary from person to person. So you start by removing these for 30 days. Gluten, dairy, soy, corn, alcohol, sugar, and in some people, eggs and nightshades. Then you want to reintroduce one food at a time every 3 to 4 days and track your symptoms. This method has benefits in autoimmune disease, particularly in studies published in Clinical Rheumatology and the Journal of the American Dietetic Association. Some people respond well to the autoimmune protocol diet as well, which follows a similar approach. Supplements are not a shortcut, but they can support gut healing. Choose quality over quantity. Evidence-based options include probiotics. You want to use a multi-strain version. Prebiotics like inulin or resistant starch to feed good bacteria. L-glutamine to help heal the gut lining. Zinc, carnosine to strengthen the gut barrier. Omega-3s for systemic inflammation. And vitamin D to help regulate immune function and reduce flare-ups. And remember, start slow and monitor how you feel, and always discuss with your healthcare provider. Number 4, manage stress. Chronic stress suppresses gut protective bacteria and increases permeability. The gut-brain axis means that emotional stress can create physical inflammation. Effective tools to help deal with that include deep breathing or guided meditation, even 5 minutes can be helpful, journaling or gratitude practice, nature walks, counseling, or support groups. This has been validated by psychoneuroendocrinology studies showing that stress changes gut flora composition. Number 5, prioritize your sleep. Sleep is when your gut repairs itself. Lack of sleep reduces microbial diversity and increases inflammation, according to Frontiers in Psychiatry. Some tips: try to aim for 7 to 8 hours of uninterrupted sleep. Keep a regular sleep-wake cycle. Avoid screens before bed. Consider magnesium, glycinate, or herbal teas for relaxation at nighttime as well. Number 6, be mindful with medications. Certain drugs may damage your gut lining or microbiome. NSAIDs, such as ibuprofen and naproxen, are shown to increase gut permeability. Antibiotics can disrupt both harmful and helpful bacteria. Proton pump inhibitors, or PPIs, which you'll take for heartburn, can reduce stomach acid and shift gut flora. These medications are sometimes necessary, but use them carefully and counteract with gut-supporting practices when possible. So here's what we now understand. Your gut microbiome trains your immune system. When your gut is damaged, your immune system becomes confused, and that confusion can lead to chronic inflammation and autoimmune issues. But you can change that. You can start to feed the good bacteria, remove gut irritants, heal your gut lining, and rebalance your immune system. Small, steady changes can lead to real healing at the root level. If this video was helpful, please give it a like, subscribe to the channel, and visit us at chicagoarthritis.com. We post regular updates on non-surgical ways to heal your joints, immune system, and overall health. And if you're ready to go deeper on gut healing and immune support, reach out to us. We're here to help. See you next time, and live well.